2018 report by the World Health Organization says India saw 60,987 deaths of children under 5 years of age in 2016 that could be linked to their exposure to PM 2.5. PM stands for particulate matter. PM 2.5 are fine particles of diameter 2.5 micrometers or less. They are found in the air, including dust, dirt, soot, smoke, and liquid droplets. They are 30 times finer than human hair and can enter the bloodstream, increasing the short-term risk of heart attacks and strokes. The other major pollutant is PM10. These are coarse dust particles of diameter ranging between 2.5 micrometers to 10 micrometers. The worst air quality index AQI level in Delhi NCR 435 was recorded in RK Puram as of 2:30 pm on November 5th. An AQI level above 401 falls in the category of severe, the worst category possible. The WHO prescribed limit for PM 2.5 is 25 micrograms per meter cube and for PM10 is 50 micrograms per meter cube. The recorded levels of PM 2.5 and PM10 pollutants were nearly 10 times higher than the WHO prescribed limits. Inhalation of PM 2.5 and PM10 particles has been linked to higher risk of ischemic heart disease, stroke, chronic obstructive pulmonary disease, acute lower respiratory infections, and lung cancer. In New Delhi, Dr. Arvind Kumar, a lung surgeon with a career spanning over 30 years, notes.
So what we have noticed is that earlier we used to see pink lungs. These days we don't see pink lungs at all. Most of the lungs are black, even in non-smokers. So I dare to say that in Delhi there is no non-smoker, and our newborns start smoking from the first breath of their life. A child who will be born in the city of Delhi in the next 24 hours will smoke 20 to 25 cigarettes on the first day of his life. It will ruin the child. It will ruin his lungs, it will ruin the development of his brain, it will cause hypertension, heart attack, childhood cancers, high incidence of respiratory diseases, deaths in very young age because of respiratory diseases.
Air pollution is stunting our children's brains, affecting their health in more ways than we suspected. But there are many straightforward ways to reduce emissions of dangerous pollutants. Dr. Maria Niera, Director, Department of Public Health, Environmental and Social Determinants of Health at WHO. Taking action on these startling developments, United Nations Environment Programme suggested 25 measures countries across the world could adopt to limit pollution, potentially helping 1 billion people breathe cleaner air by 2030. These measures, spread across 3 categories, encouraged governments to regulate emission standards and controls for industrial plants, cars, and even power stations. Along with this, it suggested governments to take measures to deal with solid wastes and agricultural residues, forest fires, brick kilns, refineries, hydrofluorocarbon refrigerants, and such other issues. Meanwhile, the Supreme Court in New Delhi has mandated the sale and use of only green and low-emission crackers with specific areas and timings designated for them. It had also paused construction projects in the city as it braced for the onset of a winter with harsh air pollution.
To receive instant updates on all videos from The Wire, click the subscribe button and hit the bell icon. Pay to support independent journalism. Click the link in the description and choose the amount you want to pay.